Hi, welcome to the Win-Win Pharmacy. My name is Wen. I'm the student pharmacist for today. I would like to ask you a few questions regarding your current medication therapy to see if there are any problems with your therapy. This will take about 10 to 15 minutes. Is this a good time to be able to discuss your therapy? Sure. I'm here to pick up my prescription medications for glipizide, so I do have a couple questions for that. Can you please explain to me how I'm supposed to take it? Okay. So let me go ahead and get your medications and let's move over to the consultation section. Before we can assess your therapy, I just have a couple of questions to ask you. Feel free to stop me at any time. Can you tell me if you have a family history of diabetes, obesity, or anything? So my mom has no family history of diabetes. She's actually healthy and she's 65 years old. And now my older brother, he has type 2 diabetes. And then also, can you tell me how old is your brother? Can you also tell me if you are currently taking any medications, any other current prescription medications? Now these medications are actually going to be prescribed by your physician. I'm currently taking metformin, but I've also been recently prescribed the glipizide, which is why I'm coming here to ask you a couple of questions. Can you also tell me if you are currently taking any over-the-counter medications? These are medications that you purchase. I also am currently taking a multivitamin for women. And then also, can you please tell me if you do have any allergies to medications or foods or anything? Can you tell me if you've recently had a flu vaccine or any form of vaccination? I have no allergies to medications or fruits or anything. I do keep up to date for immunizations because my job requires me to have a flu vaccine every year. And also, can you please tell me how you take your metformin on a daily basis? I take metformin in the morning with breakfast and also in the evening every day. They have been doing really great for me, although my doctor has decided to give me glipizide to get me at my A1C target. Also, can you tell me if you do experience any side effects when you are taking metformin? Metformin usually is well tolerated for patients, but it may cause you to have nausea and also an upset stomach or anything. I really don't experience any side effects with my medications. Can you tell me how you pay for your current medications? My insurance covers it. Okay, so what is glipizide? Glipizide is also known as glucotrol. It's actually going to be used for your type 2 diabetes. It's normally well tolerated and inexpensive, but what it targets is that it actually targets your blood sugars right after you're done eating. So they also call this your 2-hour postprandial blood glucoses. Adverse effects or side effects with glipizide is that it can cause you to have a decrease in blood sugars. It can cause you to have weight gain associated with it. And also when you are taking glipizide, you want to take it 30 minutes before your meal, preferably your breakfast. So you want to go ahead and take it with breakfast. And also what you want to do is you don't really want to break them or chew them or dissolve. Just go ahead and swallow them as whole. And also do not drink alcohol while you're using this drug. So since glipizide can cause you to have a decrease in your blood sugars, what you want to do is be able to recognize the signs of a decrease in blood sugars. So signs such as drowsiness associated with it, confusion, weaknesses, and also dizzinesses are actually going to be signs for a decrease in your blood sugars. So what you want to do is go ahead and consume 3 to 4 oral glucose tablets. Go ahead and consume 4 to 6 ounces of your fruit juices such as apple juice and also your orange juices. And also you want to go ahead and consume 8 to 10 Lifesaver candies. Go ahead and have those in your pocket also. What you want to do is go ahead and wait 15 minutes after you've consumed them, and then go ahead and use your glucometer to measure your blood sugars after 15 minutes. The goal is to be able to have a blood sugar of greater than 70 milligrams per deciliter. Once you have reached that goal, what you want to do is go ahead and to consume proteins and then also complex carbs to be able to continue so that to be able to bring back your blood glucose levels, and also so that you won't have another hypoglycemic event or a decrease in a blood sugar event. This is to prevent it. Good luck. Thank you for your time. If you have any questions, please feel free to call us at the Win-Win Pharmacy. Thank you.